Wow. Implicit bias in technology. You know, it's something we just don't talk enough about. I know for me, something as simple as an emoji with skin tones or the new non-gendered emoji characters is a great first step. But like I said, this is a tough topic, so let's crowdsource it. Where are you seeing inequity in healthcare? Tell us what you think needs to be done to address this. Use the QR code to tweet us. Use hashtag HIMS22. With that, let's check in on my friend Rachel and see who she has in the studio with us today.
Thank you, Chris. I am joined now by Milton Chen. He is the CEO of VSee, who is doing incredible humanitarian work, helping those impacted by the war in Ukraine, which we know is a very big deal right now. His organization is providing connection to medical care and supplies, and he's here to tell us more about those efforts. Thank you, Milton, for taking some time.
Well, thank you so much for having me.
Yes. Before you tell us about the incredible work you're doing in Ukraine, tell us first, what does VSee do so that we have an understanding of where we're going with this?
Yeah, so our company do two things. The first thing is we are the company provide the software for a lot of the telemedicine company. Our most famous clients are astronauts. So 100% of telemedicine from space. Thank you so much. It's done by our software. Then the second piece we do is we have a large physician network who can actually provide the telemedicine services.
And these physicians are all over and mostly in the U.S., right?
All in the U.S., all over the place, yeah.
That's incredible. And you know, we often hear a lot of misinformation in this day and age with scenarios such as the war in Ukraine, but your providers, you know, they're in direct contact with boots on the ground, people on the ground. So what's really being identified as their biggest healthcare need, and how is VSee meeting that need?
Yeah, so we've been having like constantly daily communications with all the way from Ukraine Ministry of Health, all the different hospitals. So there's a couple of segments. The first one is just battlefield trauma, shrapnel, bullet wounds, that's one sector. The second sector is just access to specialists, because now with the whole war situation, it's very difficult to have the specialist provide the expertise in. And then the third class is just primary care and chronic care. In fact, this was something through conversation with Ukrainian physicians, it was something I didn't expect at first. I thought it's more that, but turned out that if in those war situations, you have people living in the bomb shelters, you're not going to get out there, go see a primary care doctor.
Wow.
In fact, what's interesting we find is by providing the primary care to the people, you actually improve their mental health. They know they're not alone. There's actually a physician supporting them.
Somewhere in the world. It might not be in Ukraine, but they're there. And
they're not forgotten. There's people there, they know they're there, they're supporting them, they're cheering them on.
Yeah, so you're meeting a lot of needs then with your care, and it's incredible to hear because you have thousands and hundreds of doctors volunteering to really provide their services. So tell us a little bit more about this element, which I find really interesting, that the doctors are in the U.S., but they're treating patients in Ukraine, and how does all of that work?
Yeah, so normally, let's say I'm a doctor in the U.S., I cannot practice medicine in Ukraine or another country because I don't have license to practice there.
Right.
So we're working with the Ukraine Ministry of Health. They give us, our company, a blanket waiver. There's no liability, no malpractice. We're able to provide any physician through our network, see any patient in Ukraine. There's no liability in this. So that was one of the key things that with the Ministry of Blessing, now we can actually officially support them.
Yeah, and you were telling me beforehand that you're sort of like the virtual 911 dispatcher is how you described it.
Yeah, so what was interesting is like our approach to, so our company background is I have been to Iraq 3 times, I've been to Syria, I've been to about 50 countries doing this medical volunteer work. I think I might be the only CEO of a telemedicine company in the whole show who actually been to Iraq to volunteer. And through our experience doing those what we find is you cannot go into a situation like assuming you know everything. If you do that, you're not going to be able to. So our approach is that we don't know what they really need. So what we're going to do is just like a 911, we're going to set a dispatch system. I mean, anyone in Ukraine, whether it's a physician, nurse, or a patient themselves, they could go to a website, they could submit the request, and then there will be a live connected to our Ukrainian volunteer. They could continue chatting, get additional information. Then the dispatcher, just like a 911 dispatcher, then we connect to the physician, the patient, arrange them to do the telemedicine session.
Wow. And you even have translators on hand if needed, or you even have doctors who are Ukrainian and can and handle the language barrier, which is incredible. And then you were able to set this all up in 3 days in the middle of war in Ukraine. That's got to be one of your success stories with telehealth medicine.
Yeah. So one thing we've been doing telemedicine for many years. In fact, we spent over 500 man years of engineering to build out this platform. And our approach to build a platform, we just on purpose is we make almost like a bunch of Lego building blocks we could quickly shuffle. So when we stand the system, the first 24 hours, just take out the Lego block, assemble into the workflow I mentioned. The next 24 hours, we get translate everything into Ukrainian. And then the third day, we get the volunteers, everything trained up, then we start seeing patients.
Wow. It's just incredible what we can do with this, with technology today. And then what would you say, have you seen any challenges with the tech aspect, right? We know as citizens from the outside of Elon Musk coming in and bringing in his magical satellite internet and being able to provide that. But what has been maybe some of the challenges in a situation as specific as this in Ukraine, and what have you learned from that?
So the good news is the internets are still stable. So like I said, we're doing calls. Some are satellite through the Starlink. Some are just regular cell phone connection. And so the good news, that one is still stable. I think the challenge is this morning we had a case. There's a 12-year-old. He's sick. There's no medicine. He's running out of food. So the parents just like really. So that's a part, to be honest, I feel really sad because we could do the telemedicine piece, but in terms of food and the logistic in the war situation, there's only so much we could do from there. So my goal, my thing is the telemedicine piece, that's almost easy versus rest of the logistic and getting things in there.
Yeah, it's incredibly heartbreaking, the stories we've seen, and we're only seeing, a tiny piece of what's really going on. And I'm sure that the HIMSS community would love to figure out how to support and even maybe volunteer, or what can we do to support you in this?
The best place is the website for this is called seeamy.com/Ukraine. We're using Amy as the brand for providing this free service to Ukraine. I think the type of volunteer, we would love to give like Ukrainian physicians or nurses who can be volunteer, because again, we don't need translator, we could directly, that would be the number one thing. The number two thing is we have a list from the Ministry of Health. There are a lot of these various pharmaceuticals. We would love to have HIMSS or partners to able to contribute the pharmaceutical. We do have logistic that could get these things to the border or in there, but just having partner we're able to provide those. I think those would be the wonderful things.
Yeah, because that's really the next step of it. Getting the supplies into a war zone is challenge when you've got people trying to get out, and you need to get in, and you need to get that 12-year-old what he needs.
Yeah.
Exactly. Well, thank you so much, Milton, for the incredible work you are doing, and it's wonderful to hear that the HIMSS community has a partner like you doing that. So thank you.
Well, thank you so much.
Thank you. Now, we are certainly in a time of uncertainty, as we have just talked about here, which we know can be very hard, but it also elicits change. And if you can make the shifting state of life into an asset, it really becomes a superpower. And that means you're about to meet a superhero. His name is Charles Kahn, and he is a world-renowned speaker, entrepreneur, philanthropist, and author. And he is here today with his visionary keynote, Imperfectionism, Dragonflies, and a Current Behavior, Mindsets for Creative Problem Solving.